Hi, everybody. Dr. Ife Emenaha here today to discuss diabetes mellitus. We're going to focus in on type 2 diabetes mellitus. There are two types, type 1 and type 2. And the goal of this exercise is to encourage people. Upon diagnosis of hypertension, a lot of people are just so overwhelmed. They don't know exactly what to do. They don't understand. They don't know which way to go. So that is the whole premise of this exercise, to ensure that people are not intimidated. They are not bamboozled. They are not, overly panicked. They understand that what they need is information, and the information is power. So once they know exactly what to do, they understand the disease, they understand what they need to do to prevent the complications that may be anticipated, they will do the healthy lifestyle changes that are necessary and do what they need to do to maintain a very good quality of life. So that's our hope, what we hope to accomplish in this exercise. Type 1 diabetes is basically autoimmune in nature, in pathophysiology. That means insulin, which is produced by a special cell in the pancreas, the islets of Langerhans, that insulin is not being produced in type 1. And so the individual, this is discovered early in life, so the individuals have to get exogenous insulin from the outside, and then enough to balance the activity they engage in and to balance the food they eat. Okay. Now, talking about type 2 diabetes, it's a chronic progressive condition that is associated with not enough, insufficient insulin, and also insulin resistance, meaning that in some cases the insulin are there, but the cells do not recognize it. So maybe because of weight gain, because fat cells don't respond, or one thing or the other, the insulin is there, but it's not being recognized. Okay. So that takes us to what exactly is insulin. Insulin is a hormone. It's a chemical messenger. It is produced in the body in a special cell in the pancreas, and it travels via the blood. And this job is to make sure that when food is digested, like carbohydrate food is digested to glucose, broken down to glucose, which needs to enter into the cells to give the cells energy, ability to do work. So this insulin facilitates the entrance of the glucose into the cell. It's like lock. Picture it like use the lock that unlocks the door of the cell so insulin can go in. So when the insulin is not enough there's not enough insulin, or insulin is there, but the lock is not working, then the glucose will build up, to a level that is dangerous to the cells, that is damaging to the blood vessels, leading to complications in almost every cell and organ in the body. So, what is our goal? Our goal is to maintain a good blood glucose control that ensures that there is not too much glucose in the blood and there is not too little glucose in the blood. Okay. Now, when people are diagnosed with, you have to know that most of these conditions, hypertension, arthritis, diabetes, There's actually no cure yet for them. So when people are diagnosed, it's not a time to panic, it's a time to begin action. There are some lifestyle changes that we must make when we are diagnosed of diabetes. One of them is one must monitor the glucose regularly. So that means the blood glucose has to be maintained and monitored. When you monitor it on empty stomach, we call that preprandial, the blood glucose, you want to maintain it between the levels of 70 to 130 milligrams per 100 cc's of blood. When it is after food, in people who have diabetes already, we want it to be like less than 180 milligrams in 100 cc's of blood. Okay? So we want to maintain it. And there is another monitoring system we have. We call it hemoglobin A1C. This monitors the hemoglobin, the rate at which it draws glucose, how much glucose it has sucked in, because the lifespan of hemoglobin is 100 to 120 days. So this tells us what has happened in the blood glucose level in the past 3 months. It is more dependable, it is more, predictive. So for people who already have diabetes, we want it to be less than 7%. Okay? So we want it to be less than 7%, the hemoglobin A1C level. Okay, we monitor the blood glucose. We make sure we eat the right foods, plant-based food, food that is high in fiber, food that is high in vegetable. We need fruits, and we want to snack not on sweets, but on nuts, like cashew nuts, like almond nuts, and all kinds of nuts. We want to avoid alcohol because alcohol promotes hypoglycemia. We don't want that. As I said earlier, we don't want the blood glucose to be too low. We don't want it to be too high. Because if the blood glucose drops, it can drop to the level that we can go into coma. And if somebody is not there to give us, or we didn't act quickly to take some fast glucose like apple juice, milk, or orange juice quickly, one may lose their life over something that simple. So that's why we want to modify that alcoholic habit. Another habit change we need to do is regular exercise. It's very important because when we exercise, it causes the cells to be more sensitive to the insulin that is present. Then we have to monitor our weight. We have to keep our eyes on our weight, and then, of course, take our medications. Okay, now these are what are the things that may happen to us when we fail to do this. In other words, complications. A lot of every cell in the body is implicated. Why? Because when the blood glucose is high, it begins to damage the blood vessels. The blood vessel begin to bleed, and then the small capillaries in all parts of the organ, like the eyes, the back of the eye, that where the image is for the retina, we see that the retina weakens and we begins to leak fluid, and vision begin to go down. Another risk that we run in the eye is increased pressure in the fluid in the eye, intraocular pressure. We call that glaucoma. We also see film in our field of vision in the lens, which we refer to as cataracts. All these make vision even worse. But if we manage the blood glucose, maintain it at the right level, eat the right food, keep ourselves exercised up, take our medicines, go to the doctors, check regularly, these things will be seriously minimized. In the vessels also, we have the hardening of the vessels as these vessels blood vessels begin to leak and damage. Atherosclerosis, and then we see more chances of developing cardiovascular problems. These problems include angina, chest pain, that is associated with extra exercise or movement. When the heart is demanding more blood, the blood is making effort to get into the heart via the coronary artery. We see friction and we perceive it as chest pain. This may lead to even heart attack depending on how severe the blockage is. Most cardiovascular problems you see commonly associated with people who have diabetes that is poorly managed. We also have kidney damage, because the same thing is happening in the vessels of the kidney. And the kidney, whose job is to filter dirt and filter what the body doesn't need out of the body, is not able to do this filtering. So we say the kidney has failed. Nerve damage, we also see, especially the peripheral nerves, the hands and the feet. You see there is decreased sensitivity in these areas in people with diabetes that is poorly managed. The person will be feeling numb, feeling like you're wearing an extra shoe on your feet, or tingling sensation and all that. These all are results of what? Nerve damage. Even in the GI, we see the nerve damage. So the damage is everywhere. But our goal is to mitigate all these battles. How do you do it? You need to be very careful. There's going to be a change in the way you eat. You need to watch your portion size. You need to eat, some people advise to eat frequent, like 4 or 5 small frequent meals a day. But make sure that whatever you eat, there is not excessive of carbohydrate. Reduce the level of the carbohydrate, increase fiber, increase plant-based food, vegetables, raw vegetables. Also do a lot more, do protein, but the protein has to be also size. Look at the size, like your hand will be, the palm of your hand will be the size of the protein. The palm of your hand will be the size of the carbohydrate. Then like double or maybe even triple will be the raw vegetable and of course fruits. And you need your fluid, good proper hydration, but not sodas and not alcohol, not those, just fluid. Clear water is very good. And one of the things that people have talked about, some of this research has not fully supported it. But one thing I advise and suggest in this is do what works for you. Some people have tried, wake up in the morning, cut lemon and boil it, and it has helped to deal with that excess hunger that is associated with diabetes. Because the hunger is so excruciating. And some people say, oh, she can't control herself, he can't control himself, he's eating, but the hunger, because the cells are starving. There is no insulin, the glucose is swimming in the blood, not getting into the cells. The cells are starving. And so the person is hungry. And the more they eat, the more they want to eat. So you see, the person is eating a lot, drinking a lot of fluid, because the kidney is making effort to push out the fluid, push out the excess glucose or solute from the blood. So these are the things that is going on. So we need to eat right. We need to change our ways of eating. We need to do more plant-based food. And we need to stay active. Something like 30 minutes of exercise, even walking, just walking, 30 minutes every day. You can do 4 or 5 days a week. If you can do the 7 days, bravo. But once you do this, you will notice your weight will begin to go down. This insulin, that little, the much you have, will begin to work better. And then you see a better and improved control of your blood glucose. So, another thing I advise also, I suggest to do is check your food. Give yourself food care every day. Make sure you check your food. That's something people have suggested. It may work for you. You may try it out. Boil, when you boil water, you can put a little bit of vinegar, apple cider vinegar in it, and soak your feet in it. You know, it's very soothing, and it helps those damaged nerves. It improves, you know, the condition of the nerves, which these things haven't been scientifically studied extensively, but people have done it and it has helped them. Don't put grease or lotion in between your toes. You know, check your foot, warm it, keep it comfortable, wear very comfortable shoes. Avoid going barefooted, because if there's any damage, it can lead to, you know, sores that may have delayed healing. So hopefully this has helped you, and we probably will be uploading some more videos on more information on this diabetes. So, but don't panic. See your doctor regularly, check yourself, and monitor your blood pressure very well, because that's another complication of this condition. So monitor your blood pressure regularly, see your doctor regularly, eat right, exercise, have a good outlook towards life. Wear comfortable shoes and comfortable clothing. Thank you, and God bless you. Okay.